All right, let's dive into something we've all experienced, the physical exam. We're going to pull back the curtain and find out what's really going on when your doctor starts listening, tapping, and pressing. It's some seriously cool detective work. You know that moment, right? You're sitting there on the exam table, and your doctor starts tapping all over your chest and back. Have you ever just thought, what are they even doing? Is this just random? Well, I promise you, it is anything but random. Every single tap, every touch, it's all part of a very deliberate investigation. You can almost think of it as a secret language. Your doctor is basically communicating directly with your body, asking it questions, and then listening very, very closely for the answers. These are techniques that have been around forever, and they can reveal a ton of information, often way before any fancy scans are even considered. So this whole investigation really boils down to two key detective tools. The first is percussion. That's the tapping part. And the second is palpation. That's the feeling part. Let's break down exactly what each one of these tells them. First up, let's talk about decoding the sounds. That tapping thing your doctor does, it has a name. It's called percussion. It's a fascinating technique that kind of turns your body into an instrument. And the sounds it makes, well, they tell a whole story. So percussion is just that, tapping on a surface to figure out what's hiding underneath, all based on the sound that comes back. This idea was actually dreamed up by an Austrian doctor way, way back in 1764. The whole idea is that the vibrations from the tap travel through your body, and whatever they hit on the inside completely changes the sound you hear on the outside. Here's the perfect way to think about it. Imagine you're trying to hang a picture on a wall. You tap along the drywall, right? When you tap on a hollow spot, you get that loud, booming sound. But the second you tap over a solid wooden stud, the sound becomes quiet, flat, kind of dull. Your body works on the exact same principle. And it all comes down to some pretty simple physics. Organs that are full of air, like your healthy lungs, have lots of room for sound waves to vibrate. That creates a loud, low, and long-lasting sound. But dense, solid organs, like your liver or your heart, they don't have that air, so they don't vibrate as much. The sound they make is quiet, higher pitched, and really short. So this brings us to the actual vocabulary that a doctor is listening for. They are trained to hear the subtle differences between these key sounds. There's the pulmonary sound. That's the loud, low, clear sound you'd hear over healthy, air-filled lungs. Then there's a dull sound, quiet and high-pitched, which is what you'd expect over a solid organ like the liver. And finally, a tympanic sound, loud and high, almost like a little drum, which you'd hear over an air-filled space like your stomach. Now, the technique itself is actually incredibly precise. It's not just random tapping. The doctor places one finger, called the plesimeter, firmly against your skin. Then, they use the tip of a finger on their other hand as a tiny hammer to strike that first finger. The whole motion is this quick, snappy flick from the wrist. It's all about creating the perfect vibration to get the clearest possible sound. Okay, so that's what your doctor is listening for. Now let's move on to the second major tool in their detective kit. After listening, they use their sense of touch. This process is called palpation, and it's all about feeling for clues you just can't hear. And palpation is as old as medicine itself. I mean, we're talking about a technique that goes all the way back to Hippocrates. It's a really systematic way of using the hands to examine the body, and it gathers just a massive amount of information about everything from your skin, right on the surface, to the organs buried deep inside. So what are they actually trying to figure out? Well, they're feeling for the size, the shape, and the density of your organs. They're checking if things feel smooth, like they should, or if they feel lumpy. And maybe most importantly, they're pinpointing any spots that are tender or painful, and just making sure all your organs are where they're supposed to be. It's an incredible amount of data to get just from touch. All right, now let's put it all together. This is where the doctor really becomes a detective, combining the clues they get from both sound and touch to solve a medical mystery, especially when they're examining your chest. So let's picture this. A patient walks in with a super common problem. Doc, I've got this bad cough and it's getting hard to breathe. The investigation starts right there. The doctor's first thought is, okay, why? Is this just a simple chest cold? Or could it be something more serious, like pneumonia? So, in a healthy person, when the doctor percusses their chest, they expect to hear that classic, normal lung sound. It's that loud, clear, resonant sound that tells them the lung tissue is full of air and working just fine. That's the baseline. But what happens if a part of that lung is filled with fluid or it becomes inflamed, like in a case of pneumonia? Well, it's not a hollow, air-filled space anymore. It's become dense. So when the doctor taps over that specific spot, the sound completely changes. It becomes quiet, dull, and higher pitched, the exact same sound they'd hear over a solid organ. That change, that is a massive clue that something is wrong right in that spot. And this brings us to a really, really important point about modern medicine. Even with all the incredible technology we have at our fingertips, these fundamental, you might even say low-tech skills are still absolutely essential. When you strip it all away, the physical exam really just comes down to the skilled use of two of our most basic senses, hearing and touch. They are the absolute bedrock of a good diagnosis, giving the doctor instant feedback that helps guide everything that comes next. And here's why this really matters to you, the patient. The clues they gather from just tapping and feeling help your doctor form a theory and make critical decisions right there on the spot. They can decide if you need an X-ray, what kind of medicine might help, or even if you need to go to the hospital, all based on what they learn from this initial hands-on investigation. So the next time you're in the doctor's office and they start that familiar tapping, you'll know exactly what's happening. They're not just tapping away randomly, they're speaking a language. And it really makes you wonder, doesn't it? In this age of high-tech MRIs and CT scans, could it be that the most important diagnostic tool we have is still a doctor's own